Welcome to AnimalChat, an Alberta SPCA podcast where we discuss animal welfare, animal behavior, and animal protection. I'm your host, Dan Colby, and thank you for listening and for being passionate about animal welfare in our province. On this episode, we're talking about allergies in pets. They're more common than you might realize. I recently caught up with Dr. Vicki Janes, the Alberta Veterinary Medical Association Veterinarian of the Year, to talk about pets and allergies. Here's our conversation. Dr. Janes, thank you very much for joining us today. We're talking allergies in pets, not people who are allergic to pets, but pets who have their own allergies. Is this more common than we realize?
Yeah, absolutely. Not only is it very, very common, but I think people are starting to understand how common it is. We have people who are on their second pets or their third pets that their first thing they know is they're like, oh, my dog has an ear infection. Is this an allergy? So a lot of people are already worried right off the bat. Either they've had previous experience or they're on Dr. Google and they're just like ready as soon as they come in. Is this an allergy and what do we do now? Mm-hmm.
So is there a percentage of how many animals might have it? Is it cats? Is it dogs? Is it both? How does that look?
It's definitely both. I think the percentage is probably a little skewed. I don't know literature what the percentage is for all dogs in general, but we see a high proportion of them because those are the ones that are coming in to be seen. They're the ones with ear infections. They're the ones with rashes or scratching and keeping the owners up at night. So it's a lot of times we see more of it because they're the ones that need the help.
Dogs or cats? I'm going to guess dogs probably see a little bit more of it just because they're out and about more than a lot of cats.
For sure, and we do see as well. So there's definitely breeds that are predisposed, and we'll probably get to that in this conversation. But also just with the trends in what breeds people are purchasing nowadays or adopting nowadays, we do see right now everybody loves Frenchies. They're the thing. Frenchies and Doodles we see a ton of, and so there's going to be a lot higher percentage of allergies in those breeds because of the way that we breed them to make them look so adorable. So we do see certain breeds that are going to be more affected, but also just because of the trends. So Frenchies weren't as popular as they are now back in the day, and now is with their popularity, we'll definitely see a lot more allergies for sure.
And is that just because there are more of them, or is that breed predisposed?
Both. There's definitely more of them, but they are a very highly predisposed breed. In general, our bulldogs, and I do have that literature for you, in the bulldog breed, which a Frenchie is short for French bulldog, and then our other bulldogs as well, English bulldogs, American bulldogs, literature shows that 100% of those dogs have some degree of allergies. So whether they're clinical or not, it's there. And so usually if we have that breed come in, right off the hop, we're talking about that at one of our first visits for sure.
And what is it about the breed? Is it their challenges with breathing, and then I know there's a terminology for the type of dog that they are. What is it that causes bulldogs to be?
I think it's just because they are so line bred. Air quotations. So line bred just meaning a fancy term for breeding back to somebody else in that line, meaning some relative that they were rebred to, so that we can keep certain standards. So we bred them to have little short stocky legs. We bred them to have the short stuffy face. We bred them to look super adorable and have these really tiny backs and these certain types of hips and things like that. And so we bred them that way, and therefore they have an exceptionally sensitive immune system. So allergies essentially is an overactive immune system, and their immune system is very overactive. In certain countries, they've actually banned the breeding of certain breeds just because of how detrimental we have made their health in breeding them, unfortunately. So yes, it's part of the fact that they're smushy face, but also just because of years and years and years of turning them into what we wanted them to look like, despite the fact that it wasn't so great for their health.
You mentioned doodles as well. Any other breeds that you see for allergies?
Absolutely. We see a lot of Labrador retrievers, especially because they love to swim. So a lot of ear infections in the Labradors that love to be in the dirty water. Doodles in particular, depending on which line that they like to come. So doodles are also a very popular breed right now. And we call them doodles because it's a poodle mixed with something else. So we've got Labradoodles, we've got golden doodles, we've got, I've seen Rottadoodles, Aussie doodles, you name it. So they're mixing everything with a poodle. So if they were already a predisposed breed and then we mix it with a poodle, it depends on which line will be more dominant. So we do see a lot of allergies, unfortunately, in doodles as well.
So if that's a concern to a pet owner, it's something to research before they decide which breed they want to invite.
Absolutely.
To the home. Yeah. Are there certain things that dogs are allergic to, or is it the same as many of the things that we as humans would be allergic to?
Yeah, so the sky is the limit, literally. So we do see both environmental allergens, so things that grow outside. We see environmentals that are indoor as well. Allergies that are environmental indoors, if that actually came out of my mouth right. And then we see food allergies. And so we've got sensitivities that could be things to grass, trees, weeds, pollens. The primary indoor allergen that we see a lot is dust mites, house dust, different types of indoor molds and things like that. And they're not dirty houses when we say dust mites and molds. They're microscopic. They're things that live in carpet. They're things that live in your air vents. And then in terms of food, we've had a lot of dogs that have food sensitivities, and it can be primarily, we suspect that it is our protein sources, but historically we can have them be allergic to anything. And a lot of our food allergies are acquired, so it's things that they will develop a sensitivity to by exposure to it over a long period of time. So dogs that are fed the same food from puppyhood till the age of 8 might all of a sudden develop an allergy to whatever was in that particular food. So sometimes the easiest method is to just try a different food right off the bat and see if that makes a difference.
Are these things that just make the dog uncomfortable, or are there serious health risks involved? Absolutely.
So the poor little bulldogs, I feel, are the worst ones that get it. And I would definitely say the severity of their allergies can be a quality of life concern. I've seen them that are so bad, it's like those little commercials that they have on TV with like Sarah McLachlan singing in the background and this little thing that has no hair that they're trying to, get you to fundraise for. They look like that, but they live in loving homes and happy homes and they have good lives, but their skin is so inflamed that they're naked. They don't have any hair, they have rashes, they're scratching themselves to the point of bleeding. Their skin is so inflamed, they've got bumps and lumps and all sorts of pustules and things like that all over their skin. And they're just so uncomfortable, like they can't even sleep at night. The owners can't sleep at night because they're either lick, scratch, scratch. So it's hard that, you don't even want to bond with your pet because you can't even touch the poor thing. It's so uncomfortable. And then there's some dogs that are just mild, where they might get, 3-4 ear infections a year where, quality of life wise, yeah, totally fine. You do some management things, keep them out of the water, clean their ears on a routine basis, and they're totally fine. So the range can be very vast in terms of how severely they're affected.
So you've touched on it, but I'll ask, how easy or difficult is it to treat? Obviously, the more severe cases sound like they're far more difficult to treat.
I would say allergies are probably one of the most frustrating medical conditions that you could have in a pet because it never goes away. It's always some version of management. So you're changing the food, you're monitoring what they eat, you're checking what kind of treats they get. And those are for the dogs that have food sensitivities. For the dogs that are allergic to the environment, you're using HEPA filters, you're getting rid of your carpets, you're having your dog on either allergy injections or allergy allergy medications, you're bathing them, you're using creams, you're cleaning their ears, you're cleaning their face folds, you're washing them out after they come in from outside. So it's to have a pet with allergies is a lot of work, a lot of money, and a lot of effort for sure.
Is there medication that helps as well?
Absolutely. And the nice thing is with the last few years, with allergies becoming much more common, the treatment for allergies is becoming a lot more widespread, a lot more options that are available. And we've also are starting to get more doggy dermatologists that have been coming back into the area. Previously, there was only one or two dermatologists or doggy skin doctors that you could refer to, and they weren't even in Edmonton. They had to go to Calgary, or you had to go to BC or whatnot, and there would be like a 9 or 10 month wait period. There's now 1 or 2 clinics in Edmonton. There's doctors that may not be specialists, but they have very special interests in allergy cases. And so there's a lot more options too for people to have higher discussions with experts, aside from us general GPs here. In terms of trying to get those allergies under control. And so that involves a lot more testing and things like that. But if you have a pet that is that severe, a lot more people are wanting to do it because they know that their pet's not comfortable.
You've touched on some of the symptoms, obviously, rashes, scratching, itching, those ones are fairly obvious. How would I tell if my dog had an allergy that maybe was just gunking up the eyes or the nose or that type of thing?
Yeah, so the biggest symptom with allergies, I would say, or the main sign with allergies, and with every pet, each affected area is very different. But the issue with allergies is they just keep coming back. So if your dog had, say, a goopy, watery eye, maybe a little bit of sneezing, you treat it, it goes away and it doesn't come back, probably not an allergy. If you treat it, it goes away a week later, back again, or you treat it and then in fall time it comes back again, and then again in spring, and then again in fall. So the primary thing with allergies is because they just don't go away, reoccurring similar problems is one of the things. So for people that are like, I just can't get rid of my dog's ear infection, nothing is seeming to treat it. It's probably not because the infection isn't going away, but because there's an underlying cause as to why it keeps coming back.
And do we see those coming back in the spring like humans would, if we're talking about if you're allergic to something outside?
Yeah, this season right now is our main start of our allergy season. So we're starting to see a lot of dogs coming in with the goopy eyes, the increased sneezing. We're starting to see a few little rashes develop. And then as the grass starts to change and we start growing some plants and things like that, it's going to get a whole lot worse. So spring and fall tend to be, for dogs with seasonal allergies, the worst, but depending on what they're allergic to, those can last the whole season. So sometimes they'll get reprieve in winter, sometimes they won't, depending if they have an indoor allergen. As an example, I have a stepbrother. His dog is great in the summertime, in the spring and fall, but terrible in the winter. So when we allergy tested the dog, he was allergic to everything inside the house. So in summertime, it's great because he's outside more often, so he gets a reprieve, but inside the house, he's allergic to his shadow, essentially. So it's one of those cases where, yeah, he'll get a little bit of a reprieve, but because he's exposed to those environments every day, he's on medications on a routine basis.
And those more milder cases, the ones that aren't the bulldog severe itch, how do you treat those? What medication, anything else?
You bet. So a lot of times we just do medications. So some dogs that are seasonal, we can do, we treat them for their main seasons. The off season where they're not so bad, we don't necessarily do therapy for. For dogs that have food allergies, oftentimes once we manage to find a food that seems to work well for them, they're on therapy initially, and then if we can find a food, they might not need it as often. Maybe once or twice a year they'll have a bit of a flare-up, or if they get into something, the garbage, someone feeds them at a barbecue. And then in terms of the dogs that have, maybe one ear infection a year, we just treat it and then deal with it again once it comes back the following year.
We've mostly talked about dogs. Cats as well, Hannah?
Yeah, so cats do. Cats can have the same, so either environmental allergies or food allergies. They can present similar in the sense that they can have skin rashes, reoccurring ear infections, itchiness, and it doesn't always have to be kitty cats that go outside. We can have cats that are strictly indoor that can have those same allergens develop, and a lot of times it's because our environmental allergies are airborne. So it's your windows are open during the summer, those pollens and things are coming into the house. They can have those allergies indoors as well. It's definitely a lot lower proportion of kitty cats with allergies, but they can be very severely affected as well with some of those reoccurring ear infections and scratching themselves to the point of bleeding and losing hair. Mm-hmm.
Any specific breeds that are more susceptible with cats?
Purebreds, of course. So we've got the purebred kitties that tend to be more sensitive. So we've got our Bengal cats. Sometimes they'll have food sensitivities that affect their tummy also. So not just their skin, but their intestinal tract. We do have some random, breeds of cats, like domestic short hairs, and that will get it. But definitely a higher proportion in our purebred kitties.
And is it the treatment the same, similar, whatever you...
It's a little bit nicer in cats, I find, because cats just seem to, they're tough, they can tolerate so much. So kitty cats, oftentimes we don't have nearly as many options for medications because we're like, here's this one type of pill. We'll formulate it in any form or fashion for you, but you get one choice, and the majority of cats do fantastic with it. So we haven't really had a need so far to extend that for kitty cats because they just seem to do very well with the same treatment across the board.
When we're talking cats and dogs, you had mentioned that the pets may develop the allergies over time. So is age a factor in this?
It is. So the age of onset oftentimes will give us an indicator too about what they might be sensitive to. Environmental allergens will often start at a very young age, so they can be 6 months or older. Whereas our food allergies can definitely start at a younger age, but if we have a pet that's middle-aged or older, so if we have a dog that comes in, it's 9 years old, and all of a sudden it gets these reoccurring rashes, aside from some other medical issues that we would investigate, if it does turn out to be an allergy, we're going to assume that that's going to be more likely a food allergy because those can happen at any age. Our environmental allergies tend to start at quite a young age.
You don't just develop those ones are, as you would say,
yes,
bred into them.
Absolutely.
For the most part. So anyone who thinks that they may have a pet that is dealing with allergies, what would your overarching advice to them be?
So if they think that their pet is developing allergies, it's never a bad idea to just try a food change right off the bat. We're not super concerned about the brand of food. There's lots of really great foods out there. The majority of the concern that we have if you're switching food is we want to switch the ingredients. So if you go and you buy, a chicken-based puppy food, you're worried that your dog might be developing allergies, so you're ready to switch them to an adult food. Just don't pick a chicken-based allergy food or adult food. You want to pick something that's maybe fish-based that doesn't have chicken, or vice versa. So a food change will never hurt. If you just try a different ingredient, it might make a difference. Does take a fair amount of time, so it's not going to be a 3 or 4 day process to see if your dog stops itching. It's a 6 to 8 week process, so at least a bag or two of a new food to see if that helps. If it did, awesome, you saved yourself a vet visit. If it didn't, then that's where you'll come in. You'll chat with the vet. They might talk about maybe testing for some environmental allergens and then go over the scope of medications that are available and how to best manage your pet based on its symptoms.
Well, thank you, Dr. Janes. I think I've learned a lot, and I'm sure hopefully the people listening and watching have learned a lot as well. The pets, the part of the family, and it sounds like the health concerns run the full gamut of what a family member can have.
Thank you for coming to visit me and having a nice chat again. I always appreciate seeing you.
If you enjoyed this conversation with Dr. Janes, you may also want to check out our episode from last summer, where I talk to Dr. Janes about the most common risks to our pets right in our own yards. You can find that episode from July 2022 on our website, albertaspca.org/news/podcasts, or anywhere where you found this podcast. Thank you for listening. Bye for now.